chiropractor, Dr. Gregory Johnson, and today we have Tracy with us, and Tracy's been coming in now for a few months and then skipped the whole summer basically because she was doing a lot of things with her church, and she's come back into town now and she's got a few issues going on, so we're going to treat her from head to toe like we do everyone. So let's check your posture first, Trace, and let's have you flex your head forward and then backwards. Your eyes closed for just a moment. Now, you can see she's got just a little bit of the forward head posture, and from where I'm at, she's got a right translation of her head and neck on her shoulders, thoracic spine, which is on the x-axis, and she's got a rotation of her head and thoracic spine twisting to the left on the y-axis. So that's called a positive theta y, cervical, thoracic, and pelvis. And then her pelvis is a little bit left of center, so that's a positive SX pelvis in BioPhysics terminology. And her head being over to the right is bringing her left shoulder up high here. She's been getting some problems in her neck and headaches and some problems even with her ears. So we're going to get her all unkinked here. Okay, here, let's see if we can add a couple inches here. And Tracy's a really good pro at this. She's been doing this for a while. But she didn't scream too loud. So I know this way. There you go. Good. Okay, now you lay back there. I'll get your hips in there. There we go. Good. Excellent. Okay, you got to get them in tight enough where they can't get away on you. You feel like you can get away, Tracy? No. Okay. And of course, you bring the legs up to relax the lumbopelvic musculature, change the angle of the pelvis, and it relaxes all the muscles of the spine. So we do her reflexes before. And we'll put this towel here. There we go. That's it. Deep breath through your nose. Keep your teeth together. Boy, that was perfect. Felt that all the way through, didn't you?
Yeah.
Yeah. Okay. Now look how much more that reflex increased right immediately after the adjustment. There's been studies done that has shown that the weight of a dime on a nerve can change the function of that nerve 60% within 60 seconds. So you can see that most all of the neurological reactions to an adjustment are very quick, usually within seconds. And that includes reflexes. And that also includes pain nerves as well. So you got sensory aspect and you got motor aspect of the nerves. Motor is where we see the reflexes. Let's go ahead and turn sideways and come over on your tummy on this table for us, Trace. Tracy and her husband are very active in the Houston community with youth groups in their church, and they've taken a couple of really outstanding trips with some youth this summer. And how many people were saved on your summer trip? Was it like 40 some people?
Yes.
40 young adults saved during that time frame, which is excellent. We're doing this video because her husband, Stephen, asked us to video her treatment. He was going to video it, actually, so we're doing it for him. But we appreciate her volunteering to do this for us today. And there we go. Now, she's got quite a bit of a increased hypertonicity through her mid-back and upper back here, which is why I put her head down a little bit further to open these joints up. There we go, better. Yep. Okay, now I'm going way down here. Yep, that's it. Good. Okay. Legs are even. Tell me how this feels coming up this time.
Good.
Is there any tightness in your lower back? No. Okay. I'm not going to use the turbonator on Tracy this evening because she's not too nice for that this evening. You can see what forward head posture does to you. It causes an increased kyphosis here in the upper thoracic spine, so we've been working on that for a while. And I know we've given Tracy some home exercises to do, but I don't know how diligent she's been with doing them all the time. That's the way it is with most patients. Kind of sometimes. Yeah. But believe it or not, the patients who really cooperate with us and do their home exercises and sleep properly on their backs with their legs raised or on their sides with a pillow under their head that fills the space between their arm where it's touching the bed and keeps their head straight and doesn't tuck their head down and forward. And then also sitting and working at the computer all day, which is what most patients do, working in an office and working on a computer, they get that forward head posture. There was a huge article that just came out in the Mayo Clinic about that, forward head posture and the consequences of that. And you can look that up online. Just look up Mayo Clinic article on forward head posture, FHP. And it'll bring it up in a PDF doc and you can print it right out and read it, and it'll be excellent reading because about 85% of the entire population has that. This is exactly what that article looks like too. Get a close up there, good. And this is right out of Mayo Clinic with all the references. They did a huge scientific study on it. So now the medical profession is actually starting to realize the significance and damaging effects of forward head posture. Perfect. Okay, now let's lay you on your back. Yeah, I've been dealing with the herniated disc in my lower neck ever since we got back from our vacation with that little parasail on that, trying to keep up with my 17-year-old son. Actually, Renee chickened out and didn't go, so I had to go. That's the reason. There we go. There. But that's why we didn't do videos for the last month, because I was getting treatment all the time myself, getting adjusted and getting some really deep tissues, soft tissue work. Slide all the way down, Tracy, and let me do your shoulders and your chest. There we go, good. Lay right on back there. And let's put your arms and hands out like this. Now what I'm doing with this adjustment is I'm adjusting the acromioclavicular joints, which is out here in the lateral part of the shoulder. It's where the clavicle attaches to the acromion process. That's why they call it AC joint, acromioclavicular. Now I'm adjusting her costosternal joints. Here's where the ribs attach to the sternum. Here's her AC joint, and I'm sore on that right side. And, yep, those ribs are even more sore there too. Okay, let's sit you up here. Good, let's face that way. And Tracy used to suffer with hiatal hernia symptoms quite a bit. Acid reflux, that's better though, isn't it? Mm-hmm. Yep. Okay. So she can have a double jalapeno pepperoni pizza now without having her stomach get all upset and burning. There we go, good. And David, I know you know what I'm talking about, David Martinez. That was his goal to come in here, and he had a hiatal hernia and acid reflux, and he wanted to eat a double jalapeno pepperoni pizza, and we got him to where he could do that goal. There we go. Excellent. Yes, ma'am. Good. Okay, let's go in here in front of the mirror. Now we get a shooter. See, when you come into Advanced Chiropractic Relief, I just pull your leg and then shoot you. This is the high velocity, low amplitude adjusting instrument that we use. Okay, let's do the flexion forward and backwards again. Much better range of motion already. Yep. Now go ahead and open your eyes. And here's her home exercise. She's going to lift up with her traps, pull back with her rhomboids. And then if you flare your hands back even more and with the palms facing forward, it tightens up all the rhomboids in the middle and upper rhomboids as well as the traps. And then we're going to bring her head straight back in the Z-axis, a little bit to the left in the X-axis, and lift chin up for me. All the way back, kind of put your head all the way back. There we go, next. There you go. A little tap on the right atlas. And a little tap right here on the left atlas. That sends a barrage of neurological impulses into the cerebellum or the hindbrain, which controls balance, posture, coordination, and all kinesthetic movement. So let's try that again. Excellent. How'd that feel versus the first time? Easier? Good. See how her posture's come up and back more now. She doesn't have as big a hump right through here, so we're going to get her act straightened out. Probably this year if she gets back in here now.
Yes.
Yep. Okay. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.